Hi, welcome back to Your Health, Your Choice. My name is Shari Kulanu. I'm the executive producer and also Dr. David's sister. I have the pleasure today of interviewing Dr. David in the second part of our three-part series of Getting to Know Dr. David. So I'm glad that you brought up Camp Wanna Go. It was obviously a project that I was involved with as well and felt honored to do so. I'm wondering if you can talk a little bit about the impact that that had on you and how it shaped where you were in your development as a pediatrician at that point.
Yeah, so, working at Tampa General, which was more with an underprivileged population, and the HIV population was, even more underprivileged than the underprivileged population that we worked with in the first place. And so it, first of all, gave me an opportunity to work with people who I probably wouldn't have had the opportunity once I got out into a private practice. But to one of the beautiful things about kids is that no matter how hard their situation is, there's spunk, there's joy. Adults, we kind of can lose that. It's easy to lose that, but to have kids who've lost their parents to AIDS or themselves are sick and having to go in and out of the hospital, and then just for this 1 week to give them the opportunity to be a kid, to just live the way you'd expect a kid to be able to live their life. There was no judgment there. Yes, we had long lines in the medicine line that I was responsible for making sure that they got their medicines every day. But I mean, some of these kids had never been swimming before. Some of these kids never had any of these opportunities. And so to be able to share with somebody and to give somebody an experience that they wouldn't have ever been able to have otherwise, it was truly remarkable. And I know it was so appreciative for these kids and their families. And when we'd get together to do our concerts afterwards, it was just, family would get back together, and just it was so amazing.
I know that that program really helped also root you in the Tampa community in a way that brought you 2 feet in, your heart in it, and that sense that you knew you were going to be staying in the Tampa area in the long haul, even if you ended up wandering into some other places in your life. Tampa became your home. Then I really think in a lot of ways. Um, I know that you opened your private practice. You had done some work outside in the private practice realm down in South Florida, and then you ultimately decided to move back to Tampa. And you opened up Holistic Pediatrics in 2005. And at that time, you were the only provider in the office. You had a staff of 3 people, two of whom I think are still with you 15 years later. So that says something. I'm wondering if you can talk about why you chose to come back to Tampa and how holistic pediatrics eventually evolved into holistic pediatrics and family care, which involved you expanding to also care for adults.
Yeah. So very quickly after we moved to South Florida, where I was offered my first job as a pediatrician, it was kind of obvious that I wasn't a South Floridian anymore, even though I grew up there. Spent the first 18 years of my life there. Once I had my experience in Tampa, in Tampa, where it would not be uncommon to see mixed race couples. It wasn't uncommon to see gay people holding hands walking down the street. And that was stuff that I never really got much of an opportunity to see at least in the area where I grew up, where we grew up in South Florida. And so, and in all honesty, Skippers, having Skippers Smokehouse here, having been here, I mean, there was a group of 100 to 150 of us every Thursday night got together and came to this communal aspect, and that was really something that I very much, it fed my soul. It just, it just hit me at the core of who I am. And we and my wife Lydia and we decided we needed to get back to that. And so we came, and I had the opportunity to start seeing patients, and with my work with autism. And what had really started to happen is that families of children who we started bringing improvements in their with their and reducing their autistic symptoms, families started saying, hey, we never had an opportunity or wish to have another child because our life became so strained, but we now have a kid that's doing well, and we're thinking it's time to have another child, but we're scared to death of having another child with autism and all the stress potential of having two children with autism, can you run these same tests that you ran and the treatments that you did for our child on us as the parents? Maybe if we could get started even before conception, maybe we could prevent this or we could minimize that. And that is how the preconception to infancy project, which I then developed, became a thing. And so, and at first, when parents would ask me this, I'm like, well, I'm a pediatrician. You really want to be? I don't know how to take care of adults. And they're like, all you have to do is take care of us the way that you take care of our kid. And and then I'm like, okay, well, as long as you're okay with, if I don't know the answer to something, then I can pull the pediatrician card out and say, I don't know about that one. And I'm a really transparent person. I will never try to make something out of something that I don't know about. I'll never try and cover it up, but I'll help you find the answers. We'll seek these things together. And so we did. And then we started having healthy babies, and we started not, and we, over the years, we never had a family who had a child with autism, who we did this from the beginning, who then had a second child with autism, even though it's about a 1 in 7 chance of that happening out in the general population. And then all of a sudden, even crazier, the grandparents started asking me if I could be their doctor. And I'm like, okay, I've gone, because I realized at first taking care of a 25, 30-year-old person is not that different than an 18-year-old. And as an adolescent specialist, I had a lot of training in adolescents. There wasn't that much of a difference. But then when people of menopause age or past that age and seniors with all of their issues started asking me, and then I kind of like, wow, I could really get in over my head over that. But I again kind of felt, but a person has a right, and this is where my beginnings of medical choice began. A person should have a right to decide who takes care of them and who they get their advice from and the type of care that they want. And so again, I would say to the next generation, as long as you're okay with me pulling the pediatric card out and saying I don't know, but let's figure it out together. And then that's how it became. And like, I take care of a few great grandparents now as well. And so, but it's just, to be part of that melty generation, talking about, like I said before, about being part of a family. Well, I'm part of a really extended family for a lot of these families now. And just to be able to I could have all three generations in a room with me at the same time. And even though the appointment may be for one, invariably it's going to end up moving to somebody else also. And so it just became such a variety of things that I would deal with. I realized early I would never be bored with my job. It was just impossible for that to be. And so next thing I know, and so we kind of, after a few years of that, said we need to change the name of the practice from holistic pediatrics to holistic pediatrics and family care. And soon after that, I had hired a pediatric nurse practitioner because I needed help on that side. But then I really started needing help on the adult side because, again, there were things that, like, okay, I don't know how to handle blood pressure with more than one medication. We need, I need help on the psych world. And so fortunately, Dr. Kathy Nutting then joined us. She actually had a doctorate in holistic health as a nurse practitioner, that she created the program actually at USF. And she had, previous to us, was working in a psychiatric office doing integrative medicine, but also knew everything about the pharmaceuticals that are psych related, as well as a lot of other stuff. And that opened things up tremendously because I would have to send people to psychiatrists, and a lot of times they didn't necessarily appreciate the more holistic approaches that I was taking with people, and telling them, avoiding medications and checking your vitamin D levels because that helps your serotonin out, and all of the different things that we do in terms of food health and gut health, and how that the mind brain connection. And so all of a sudden I had a provider who had been practicing like this for a while, and then that was awesome. And then, thankfully, I've just had the lovely experience of bringing on Patsy, our pediatric nurse practitioner, of bringing on Ethan, who is our family medicine physician's assistant. And now we have a really eclectic group of people here who, we're all part of the same philosophy. We all adhere to the holistic with the W approach, but we all have our own little niches, and we all kind of approach things differently. And I foster that. I don't want a monolithic thinking here. I want outside the box thinking here. I want people to challenge me. I may be doing something wrong. I need to learn something new. And so to have, we have our weekly meetings where we get together and we get to share all of our ideas and thoughts, and put protocols together and share research articles and what kind of things we may be interested in. And so that also makes for a really nice collegial experience that I certainly didn't have for the first 10 years or so.
I love that you brought up how it evolved from holistic pediatrics into holistic pediatrics and family care. And I'm wondering if you can dive a little deeper and talk more about the why. Why it is that as a pediatrician, you decided that it was so important to allow your patients to kind of guide you into recognizing that their choice was to be working with somebody like you. And therefore, you would then in turn expand your approach to how you made your practice set up. So I'm wondering if you could talk a little bit more about your why.
Yeah. So, I started off taking care of little humans. I'm a humanistic person. I am a big fan of humanity. And so I felt that it was important, especially since adults were telling me that they can't get this type of medical care, this type of approach from anybody else, that I kind of, in a way, felt responsible. That I needed to be able to provide this type of care that they wouldn't have been able to get. And, my entire philosophy is based upon informed consent. A, inform yourself before you can consent, but that also means that you have the right not to consent to do something. And so, whether that's taking an antibiotic, whether that's how a family wishes to approach vaccines, whether that's how they're going to choose to eat them, not eat themselves, for them to eat as well as to feed their children, that makes much more sense. Um, I just thought that was kind of just a natural extension. And for me, I want to be treated that way myself. And so, coming to the do unto others aspect, I want to be treated that way. I've had so many frustrating experiences when I've gone to doctors, and more so, especially as I've learned what I've learned. I fired my first endocrinologist after the second appointment because we got into a disagreement because I like to do more extensive thyroid testing, checking something called reverse T3, which he said that's a great thing. I check for those things in the ICUs, but we don't do that as an outpatient. And I'm like, so people don't get sick except for in an ICU. And he refused to order this test from now. I realized I could order it for myself if I needed to. But it was like, this is ridiculous. You're not listening to me. You're not hearing what I'm saying that I think is an important thing for my health. And I have all this data that backs it up also. And so, those types of experiences that I realize, hey, I want people to be able to be treated the way I want to be treated. And since I know I'm capable of doing it and I know that they appreciate it, so why wouldn't I do that?
That's really beautiful. I know that one of the things you and I have talked about, which I think is one of the reasons why so many adults have chosen to come to you, even if over the years, especially if their kids never saw you, but they've heard about you through the community, they've opted to come to you. Um, the idea as an adult of being treated with respect, but having a sense of some kid gloves on there, because when you're sick, you're dealing with a sick family member, it's hard. And to have the bedside manner that Dr. Tanis taught you when you were a kid and that you loved, and to be able to bring that full circle and offer that to people of all ages is an incredible gift that you give to people. It makes them feel cared for and loved. Whether they're 15 or 85, you still want that, right? You still want that tender loving care that comes to you. So thank you for that. One of the other things that I know, being your smarter sibling, is that you are driven by education and knowledge. You like to know things, and so you've mentioned now several times that as parents have come to you with questions, and you said, "I always reserve the right to throw up the pediatric card, but I'm going to learn that first. I'm going to try to learn it first before I just cart you off to somewhere else and tell you that I don't understand it." And I think one of the things I've seen happen is that it's come to raise your appreciation for education and for people to have the knowledge that they need to have so they can ask the right questions, whether it's of you or of a specialist. And so I know over the years you've really developed part of your core philosophy, in addition to choice, like you said, is informed consent. And part of informed consent is getting information to people. And you've developed a way for people to be able to get information in a way that they can understand. And you don't talk down to people as if they couldn't possibly understand because they didn't go to medical school. And so I'm wondering if you can talk a little bit about, and maybe this is because our mom was a teacher, sort of how you evolved into also being an educator and a teacher. You started working at University of South Florida as an associate professor in their nursing department. So I'm wondering if you could talk a little bit about how your clinical experience then started to evolve you as an educator.
Yeah, so I definitely think that intellectual curiosity was something that we had when we were growing up, and certainly having a parent who was an educator certainly instilled a lot of that. For me, it's all about wanting to learn more and more. I remember back in my medical school program, and I remember during my third year, I got really frustrated because it seemed as if every time that I figured something out, it led to three new questions that I didn't know to ask before I could figure that previous thing out. And I felt like I was like going down rabbit holes and I was getting further and further from answers, to the point where I went to the director of the medical school and I said to her, I'm really frustrated about this. Tell me, you're a very experienced person. When did you feel that you finally got it? And I remember like it was yesterday. She took her glasses off, kind of threw them down on the table, and she said, David, you just learned the absolute most important lesson of medical school. Because the reality is, a good doctor never will feel that way. And the day that you feel that you know everything, you should hang it up because you're too full of yourself at that time. And that was a very impactful moment, and that it gave me the liberty to realize it's okay for me not to know everything, but it's okay for me to delve deeper and to delve deeper. Now, I love explaining things to people. I love analogies. I interestingly, although I know nothing about cars, I have lots of car analogies when it comes to the body and to health, and different ways of explaining very complicated things. People, if you've hung out with me and talked about methylation genetics and B vitamin metabolism, which just most people are like, that just way over my head. And you know what? I can explain it to you in about 10 minutes, and you'll know more about this than most doctors. But it's also the way you explain it. But I just love coming up with analogies and ways of explaining things in a way that, like, oh wow, that really makes sense. And to me, that's actually one of the most fun parts of the job, is helping people understand. Because if they're going to make a decision, if there's choice A and choice B, I want them to know as much about choice A and choice B as possible so that they can make the best informed decision. That's where informed consent comes back to. And it might not be a popular decision. It may not be a mainstream position. It may very well be as well, because that I'm firmly rooted in anatomy and biology and physiology and biochemistry and pathology. So I'm able to take those along with my with alternative views and more open-minded outside the box views. And I tell people I consider myself like a 1 foot in the box, 1 foot outside the box type of person, because I still need to be grounded in a sense of science and a sense of all those things. But you know what? There was a time that all of a sudden someone looked at an orange and said, "What's that growing on it? It looks moldy." And then somehow or another that became penicillin. So there was a time where none of these things were coming. People really thought I was crazy when I was starting to push vitamin D 15 years ago. Now it's a mainstream thing. We hear Dr. Fauci says he's taking 5,000 because he feels it's important for keeping COVID down. Lots of research has shown those types of things. We were crazy for telling people to avoid the importance of eating organic and avoiding pesticides and other types of toxins. Big studies are now coming out that's showing that that's what's leading to for fertility issues and lower sperm counts in people now. We've known about this forever. We've known about the importance of whole food eating and avoiding of food ingredients that you can't pronounce the names on the labels. We know about the importance of having a good, healthy intestinal system, and how much. I mean, when I take a history of, the questions that I'm asking about people's poop. Like, and it's always funny asking the questions to kids because they think it's the most hilarious thing ever. But at the same time, I can learn a lot about you by knowing about how often do you poop, what's it looking like, what's it, all these different things that I get into. Really, I can write a chapter on everybody's poop, but it's helping me learn, and it's also helping them the next time that I see them. They're like, I had this experience, or because you asked, but I'm seeing some undigested food particles. What's going on there? Well, maybe your pancreas isn't making the enzymes. Maybe there's something else going on. Maybe the pH balance has been thrown off in some way. So it allows us to delve so much more into a person's case, because I'm open minded to the possibility that there's all of these things that could be going on, but at the same time recognizing it's all one body. Okay. And this reminds me, just like I remember back in medical school during this first couple of years, and the cardiologist would come and give the cardiology lecture. The heart's the most important part of the body. If you don't have your heart to pump the blood to get everywhere your nutrients, you won't survive. Okay, the neurologist comes in. The brain's the most important part of the body. If you don't have a working brain, you can't figure things out. You're going to die. And then the kidney specialist comes in and says, the kidney's the most important part of the body because if you can't throw out your toxins, you're going to die. And as each of these people make this progress, I'm like, do you guys ever talk to each other? Maybe we're all, it's all contained in this one body on purpose. And all of those things may be super important. And any of those can present a weak link that could make it that the body's not going to work better. And it was like they were seeing it in a vacuum. They were in their own little stage. And I'm like, that just seems completely antithetical if you're trying to help the person as a whole. And so that was really one of the first parts of holism that kind of came to me, is recognizing kind of it's all important. It's all connected.
Thank you for joining us for part 2 of this 3-part series of Your Healthier Choice, where we're diving deeper into getting to know Dr. David. Please join us for part 3 and subscribe to our YouTube channel and join us on social media. Have a great day.